Hi, Sanaz. Thank you so much for joining me today. You have a great background in behavioral science and its applications within healthcare, and I'm excited to talk with you today about a very specific aspect of behavioral science, nudge theory, and how healthcare organizations can use this tactic to drive behavior change. So, with that, let's just start the conversation with something very basic. What is nudge theory, and why is it relevant to healthcare today?
Sure, and thanks for that intro. So nudge theory is about subtle changes in how choices are presented, what is called choice architecture. In healthcare, nudges make healthy actions easier and more appealing without restricting freedom of choice. They can help healthcare organizations influence consumer behaviors, whether it's preventive care, adherence, or healthier habits.
Okay, so basic makes sense. Maybe you can share a real world example of nudges in action to help us get a sense for how these work.
Yeah, so there's this study I love coding because it's such a fantastic study. It's a mega study with about 700,000 pharmacy customers, showing that text reminders boosted vaccination rates by 6.8%. And it's interesting to look at the detail of this study. The most effective message used for the text message used in this study actually used the endowment effect. Endowment effect is a cognitive bias that we value what we own more than the items we don't own. So what did they do? The successful message told people a flu shot is waiting for you. So go get it. It's yours.
Mhm.
And so that's one study. At Engagys, actually, we have seen the use of nudges significantly impact member engagement. In practice, some of the most effective nudges are actually the simplest. For example, incorporating a subtle fear of missing out or FOMO prompt, such as, "Are you sure?" has been shown to increase healthcare engagement rate by up to 30%. That's a lot.
That is a lot. And FOMO is real. So I understand and I'm not surprised by that stat.
Yeah.
So what are some of the practical ways that a healthcare organization can use nudges to engage their own members or healthcare consumers to take action?
Yeah, so there are different ways. Simple and easy ones are, for example, reminders. If you think about personalized reminder, you can use it for nutrition, for exercise, for screenings, and essentially reinforcing healthy habits. There's also gamification using badges, leaderboards, and rewards to create motivation and give a sense of progress to members. But one thing is important. The key is really knowing your members and segmenting the population for tailored intervention. And that's what's called personalization. You can do different things. You can allow your consumers to tailor their own reminders. For example, choosing timing, frequency, or content to some extent. This can boost effectiveness of those nudges because it gives your members a sense of autonomy, which can enhance the engagement rate again.
Mm. Yeah, we see that a lot now with wearables and other devices that really motivate people to take actions. It's very personalized, and so that makes great sense.
Yeah.
So if I'm at a health plan or I'm in a healthcare organization of any kind and I really want to design nudges, what steps do I take first to really put these in action?
Yeah, there are some steps that we can't miss. The first thing is define your goal. We have to be clear about the behavior we want to change and influence. So that has to be very clear. Then the next step is using data, information online, wherever we can get that information. We have to understand better what's stopping people from taking action. It can be fear, it can be forgetfulness, it can be lack of motivation, it can be knowledge gap. Based off of that information, we can design the intervention and the nudge. But we don't stop there, right? We have to do A/B testing, because if we don't do testing, we have no clue what's working and what's not. So A/B testing is basically to see which messages or channels of communication resonate with members. Then we continuously improve. The point is we have to ensure nudges are targeted, effective, and adaptable.
And that A/B testing piece that you mentioned cannot be discounted. It's so important to test those iterative changes so you can really see which interventions are moving the needle. So that's super important.
Yeah, absolutely. Yeah.
So, to round it out, if I'm at a healthcare organization, I'm an executive and I'm thinking about doing this, are there any limitations or anything I need to keep in mind before I sort of embark on this?
Yeah, there is, and there are caveats to nudges. Nudges aren't a silver bullet. Um, think about the context of nutrition and healthy eating. If the problem is affordability, if the problem is access, nudges are not going to solve the problem. We need more bigger systemic change for that to happen. The other thing is that nudges are great for short-term success, but if we want lasting behavior change, deeper motivational and structural interventions are often needed. And the other thing is there are some data and research showing that nudges can actually lose effectiveness if people feel manipulated or if the approach doesn't align with their preferences. In general, if your target population, if the people that you're targeting feel frustrated, and they might actually choose to do the opposite of what you want them to do with the nudges. So nudges can be powerful. They're powerful tools, but they need to be used strategically and ethically.
Yeah, that's super important. Thank you for highlighting those considerations for people here. And I know that you have done a ton of work in this area, and you've got a great blog that we have actually posted on our website. So I would encourage folks who watch this video to go check that out on the Engagys.com website to learn a little bit more. And thank you so much, Sanaz. It was great talking with you.
Awesome. Same here.